If the G-tube comes out before it has ever been changed, do not try to reinsert it. Cover the site with gauze and call the surgery clinic immediately. If you cannot bring your child to their clinic, take your child and the tube to the Mary Bridge Emergency Department. If the G-tube comes out after it has been changed and the balloon is still intact, you can wash it in warm soapy water and reinsert it. Remember to deflate the balloon first and use lubricant if you have it. Once it is in place, reinflate the balloon and then call the GI clinic. If you're having trouble, do not force it. If the tube comes out after it has been changed and the balloon is not intact, reinsert the tube and secure it with tape. If you cannot insert the tube, tie a knot in a Foley catheter and insert the tubing about 3 centimeters deep and secure that with tape. Then call the GI clinic immediately. We do not want you to panic, but time is of the essence, as the hole can start closing as soon as 10 minutes after the tube is out.
Occasionally, your extension tubing may become clogged with formula or medication. When this happens, try flushing it with warm water. Fill your syringe with water and push it through the detached extension tube with pulsing pressure. Repeat until the clog is dislodged. If water does not work, try using cola or cranberry juice. For stubborn clogs, try letting it sit in the tube for about a half hour and then trying again. If you think the button itself is clogged, or if you are unable to dislodge the clog, call the clinic. Redness and irritation could be caused by leaking, infection, manipulation of the G-tube, G-tube changes, or granulation treatment. If the G-tube is leaking, it may be because the tube or tube size needs to be changed, the stomach is not emptying properly, or the valve or balloon is weakening. If you suspect any of these issues, call the clinic. In the meantime, keep the site clean and dry. Try placing split gauze under the tube and changing it frequently. You can also use skin barrier creams if recommended by your provider. Signs of a bacterial infection include fever, the site is red, warm, swollen, or tender to the touch, or the child is unable to tolerate starting a feed or giving medication. In this case, your child may need antibiotics, so call the clinic. Granulation tissue is dark red tissue that can grow at the G-tube site. This is not an emergency, it's just the body's normal response to heal the hole. But it will continue to grow if left untreated and can bleed or cause pain, so call the clinic for an appointment.
We hope this information helps you feel more comfortable managing your child's G-tube at home. Remember, you will get more education and practice time in the hospital before your child is discharged. When you have questions or concerns, please let us know. Up until your child's first G-tube change, you'll be calling the surgery clinic. After your first G-tube change, or if there are concerns about feeding tolerance, your contact will be the GI clinic. For pump or supply questions, call your home supply agency.